The human brain. It's the most complex organ in the body. An intricate collection of microscopic neurotransmitters, the brain is a delicate yet powerful force. Treating conditions of the brain like aneurysms, strokes, tumors, or injuries involves great risk. But today, technology is making these treatments less invasive, safer, and more effective.
I think that the growth in neurosurgery is very much influenced by technology, and it can be either pure technology or molecular biology, but it's growing, it's relentless, it's happening as we speak.
We make smaller craniotomies, and we can target the arteriovenous malformation. We know exactly where it ends, where it begins. We didn't know that in the past. There was a danger of removing a lot of healthy brain. These days, the dangers of removing healthy brain are virtually none.
The field of stroke treatment, surgical stroke treatment, is actually nascent. It's just starting, and a lot new things are coming out. Almost every year there's a new device, a new technique, a new strategy that's coming out that's helping us fight this disease more and more so.
Despite the advances in stroke care at top hospitals, experts say the most critical care starts at home. Risk factors for stroke include obesity, tobacco use, high blood pressure, high cholesterol, diabetes, drugs, alcohol abuse, and excessive soda and energy drinks. Recognizing the signs of a stroke are vital when every second counts. Remember to act fast. Be on the lookout for F. Facial droop or numbness. A. Arm and leg weakness or numbness. S. Speech impaired, mute, slurred, or confused. And remember, T. Time is critical. If you suspect a loved one may have had a stroke, get them help immediately.
As soon as we recognize somebody is having a stroke, we have to start treatment as soon as possible. It cannot wait. Because the longer we wait, the more damage the patient will have and the more symptoms he or she will have.
When a patient with an acute stroke comes in, it is very important that due attention is paid to the blood pressure issues at that time. It is about stroke risk factor modifications, especially blood pressure, diabetes, cholesterol. So the risk factor modification is very important when it comes to the stroke treatments and improving the outcomes.
For brain injuries and strokes, quick diagnosis and precise treatment is critical to preserving brain tissue and minimizing disability. Today, top neurosurgeons and neurointerventionalists use state-of-the-art imaging to detect aneurysms, clots, and arteriovenous malformations. This technology, called angiography imaging, allows doctors to rapidly pinpoint blockages or ruptures in the brain.
We use this technology to look at the blood vessels, and not only for the acute stroke where we are looking for the blockages, we also use this to diagnose patients with aneurysms. It is also used to diagnose some rare conditions like arteriovenous malformations or fistulas, which are basically abnormal connections between an artery and a vein. And it is also used at times to diagnose patients who have some rare anatomical variants or blockages in the neck vessels. So it is a very helpful machine that is still a gold standard way of looking at the blood vessels.
Tools that we use while performing brain surgery do include the operating microscope. We also use the image guidance system. We are fortunate enough here to have both the BrainLab system as well as the Medtronic Stealth system, which allow us to very precisely localize tumors, and it avoids very large exposures and injury to the brain.
We also have some capability of the microscope in which we use a fluorescein color. It's basically something which stain the blood vessel in the brain, and then you can make sure that you are not hurting a critical blood vessel, or if you manipulated the vessel, you still can make sure that indeed blood flow is going to that region.
Neurologic conditions that were once considered fatal are now treatable. The key to survival is getting quick medical attention at a top neuroscience center. The Neuroscience Institute at Provena St. Joseph Medical Center delivers complete world-class care for the brain, spine, and nervous system. As the county's first primary stroke center, the Neuroscience Institute's rapid response team is ready to receive stroke patients 24 hours a day because early treatment is key to recovery.
The mission of the Neuroscience Institute here at Provena St. Joseph Medical Center is to help to coordinate care, meaning that when patients need to see a neurologist, a neurosurgeon, if they need to receive physical therapy, if they need to be seen by all of their other primary care physicians, the Neuroscience Center strives to bring all those physicians together, also to minimize the number of visits patients have to make to see their physicians, meaning they could come in one day and receive all physical therapy, see a neurosurgeon, see a neurologist, and every other specialist that is available to us through the NSI.
The Neuroscience Institute at Provena boasts the most advanced technology, giving specialists the precise 3D imaging, measurement, and real-time mapping needed to achieve extraordinary accuracy in diagnoses and treatment.
In fact, the Neuroscience Institute cares for more than 600 patients with complex neurological conditions annually.
We operate on tumors, Chiari malformations, arteriovenous malformations. We treat cerebrovascular disease, children. We put shunts. There is no neurosurgical procedure that we cannot do.
I think we have a full suite of services for our patients. We can offer pretty much any neurological, neuroendovascular, and neurosurgical treatment options, diagnostic options, as pretty much anyone else in the city can.
A stroke is a medical emergency. The Neuroscience Institute at Provena delivers the best care 24 hours a day. For more information, visit provena.org/stjoes/neuro.